use my lived experience for many years I've had. And I'm doing peer support for a lot of women in the program um, for opioid use and street level sex work and addiction and mental health. I have two children. I have a 4-year-old and I have a 15-year-old. I'm a single mom, but we're a pretty good family unit here. I love being a mother, and yeah, my life has drastically changed since probably I'd say like 6 to 7 years. I've been clean 6 years and almost seven, and yeah, so drastic changes and so many positive outcomes now. So I was in a very bad car accident, and I was prescribed the original OxyContin, the 40s and 80s. And I was an addict at the time for cocaine, but I had never tried an opiate ever. And once I got a taste of that, it was on. I was like purchasing them off the street. And then at one point, all of a sudden, oxys were gone. They were cut off the street. There was none left. And myself and a lot of other friends were just left scrambling at that point. Um, so then in London at the time, there wasn't much heroin. There wasn't definitely no fentanyl at the time. And so we were starting to go into other pills like morphine, just random, anything we could get our hands on. And then eventually heroin came. So that just kind of just screwed everybody up from there. I had got really frustrated, so I'd start methadone. I didn't want to do the search anymore. I was just like, I didn't know what to do because my habit was cocaine. So I went and got methadone. I was on that for quite a while. I wasn't really into the opioids anymore. However, the methadone at the time, it's a lot different than it is today. You were basically high. It's not like today. It was like basically doing like a big smash of oxy. So it pretty much was a good substitute. So finally, I was decreasing. I thought I was going to get off it. I was on like 120 mils, and I started going down 5 mils, 5 mils. I got down to 13 mils, and all of a sudden I was sick, so sick. I couldn't understand it. I went back to the doctor, and he said, "Well, you're pregnant." And I said, "Oh my goodness," like, I didn't know what to do. I had been, I think I was like 14 weeks. My periods had been super irregular anyways because of the opiates. And so I was just shocked. And I asked him, I said, like, like, I didn't know anything about this. He said, "If you quit right now, your baby should be fine." So I was still doing a lot of cocaine though. So I basically went to my mom's house because I didn't know what to do, and I stayed on methadone. So I moved back to my mom's house and got on a proper schedule where they put me back up to 40 milligrams. At a recent episode where I had surgery, and they had, knowing I was an addict, with a pain management appointment previous to having surgery, and they gave me Dilaudid in the hospital, gave me fentanyl, and I knew from that first shot it was over. That first time I was gone. So I knew that. And I was in there milking it. Oh, I want more. I'm in pain. It definitely was not needed. And then they sent me home with a bottle of 30 days of Dilaudid, which I came home to and just sniffed them right up. I was always just snorter. I didn't really do any other way. And then, of course, it was on. I had to go and start looking for them. And in my position where I work with drug addicts, and I work with, right in the hood, right in the belly of drug addiction. So it wasn't hard to find. I was dodging my employees because that was so embarrassing. We work with police officers, we work with different agencies that I was so embarrassed to even let them find out. So finally, people were starting to notice like something's wrong. And my 15-year-old had walked in the bathroom and had caught me sniffing a pill. And we were talking like 4 months after surgery, this was going on. My usage was going up. I mean, I wasn't a heavy user per se to other people, but I was still doing about 4 Dilaudid a day. So Dilaudid eights. Um, and people with safe supply, it's very easy to find. They're $2 a pill. They're on the street everywhere. Very easy to find, unfortunately. So I didn't know anything about Sublocade. This is new to me because haven't been on any of this stuff in years. I had weaned off so Suboxone and stuff. So now Sublocade, and been great. It's been great. I'm still on it. I actually just called today and I'm like, when was my last dose? She said, I haven't been in since August, she said. So the Sublocade works very well. I didn't even notice. I hadn't been there. And yeah, so hopefully that's the end of my OP use from there. After I had my baby,
Mhm.
I wanted to breastfeed. And so I did continue a bit. That's a whole nother situation. They didn't allow me to breastfeed due to the fact, well, they would have allowed me, but they took my baby right away because they had a program at the time where they kept your baby for detox in the hospital. At the time, it was 30 days. They did the first 72 hours. So they kept him for 30 days. I was allowed to be there from about 11 to 11. So I did my best. I was there every single day. I never missed a visit, but that really ruined my milk supply and breastfeeding. So he was getting morphine and then they sent him home. So I asked them, I said, on the 23rd, I said, let me take my baby home. So they did for Christmas. And I was able to wean him the last week, and that was fine. I stayed on methadone, I want to say maybe another year after that because I wasn't sure of myself. I didn't feel comfortable coming off of it. Um, I did relapse on cocaine after that, but for opioid use, I didn't for quite a few years. It was up until the surgery during pregnancy because everybody just looks at you like you're a disgusting drug addict. And how did you do this to your child? And people that don't understand, like my family is very much, they don't understand any of this. So drug use to them is like, why don't you just stop? Why don't you get off this methadone? What is this crap? What are you doing? Why do you have 30 bottles in your fridge of this orange stuff? And it was difficult because I like to go to the States and I like to travel and I got to take like 30 bottles with me to go, twice a day. And there's 15 days where it was just embarrassing, especially at customs. I was looked at like, just a piece of crap drug addict. They would swab every bottle and check me over 3 or 4 times, thinking I was bringing drugs into the States, even check my baby's diaper, all kinds of just terrible stuff, the way people look at you. And when you're pregnant and you're going into these clinics, most time the clinics are in, general areas and people are just looking at you like you're going in the methadone clinic and you're pregnant. Like it was terrible. And even after parenting my baby, CAS was just like Children's Aid was just dying to get involved. Even though I was clean and they had reports from the methadone clinic, they would just constantly just try to probe and see if, oh, did you slip up? And they never really, they always kept a file of that stuff, which is another reason. It's just looked on so, look at so down on that on parents that are on methadone when I think it's the best thing to do. It's keeping them clean, as opposed to using other drugs. I think methadone's, or Suboxone or whatever is the best option. My family is very like clean and square and just like they don't smoke cigarettes, they don't drink. And to them, this was huge. Like I don't even know if they Googled methadone. I don't think they knew about it. I just so judged by it, so judged. And so when I had the baby, it was a Friday and I had him and they took him right away. And I was like, "Why are you bringing my baby back?" And they said, "Well, we don't have enough staffing to sit with you." And I'd been clean. I said, like, everything was fine. I had done parenting classes. Why am I not having my baby? So they had somehow mixed my file up with somebody else that was on the maternity ward who was a user, a big user, like way more than what I had been dealing with. And they had given me Seroquel during my pregnancy. I'd taken once, and it came back in his meconium. And anyway, so they took the baby. They had said that they had to wait for CAS, and I had to be chaperoned with my baby the whole time until Monday, basically, until the CS worker came in. And she was adamant. She was actually kind of cool. And she says, "No, I never did this. It was the wrong chart." So from there, They transferred my baby back to Sarnia. I wasn't allowed to keep him. I had to go behind the ambulance. I couldn't go with the ambulance because I was living in Sarnia, and they just treated me like shit. I was just, just another drug addict that they didn't want me alone with my own baby, and that just blew my mind. So the nurses were just terrible, terrible, terrible the way they treated me, and I could see other girls on the ward that they were doing the same too. The methadone clinic I went to in Sarnia, they were actually really cool. They were non-judgmental, and they were all right people. My mom she was what she was, but she was still a good support. She didn't understand. But really, like, no, that was it. I didn't really want to tell anybody else. I was embarrassed and ashamed, and I didn't want anybody else to know. So there was a program here too. I went to. At Addiction Services, actually, CMHA, where I work, and she was all right too, but it was just a lot. I just wanted to get through it, and there wasn't a lot of people to talk to. And like I said, I didn't really want to talk about it. I just wanted to have my baby and hope for the best, I guess. I just knew my kids, like my son, I couldn't screw up. They were waiting for that. Children's Aid expected that. Other people around me expected that. I was gonna lose my child. House these women that are just at their lowest points and give them hope, because if you don't have a home, how can you ever get anywhere? A home is where, you can get ready. You don't feel obligated to go and sleep with a trick to get out of the rain. You don't, like a house is where you can start working towards getting your kids back. So housing first is a big thing. And especially for women, I find, getting out of domestic abuse and giving them hope back, I think is huge. So I really wish these programs were available for me back then.